Hello and good afternoon, everyone. We welcome you all to our EdTech Lounge. This is our 30th EdTech Lounge session. We've been hosting these sessions since April 1st, 2020. For some of you who are attending the EdTech Lounge for the first time, EdTech Lounge is a virtual platform where faculty members share their challenges and experiences with online and remote teaching. And this is a community of practice, and we welcome you all on behalf of the Network of Quality Teaching and Learning. If you've missed out any of the previous EdTech Lounges, all the recordings of these sessions are there on the website, and I'll be sharing the link in the chat before we end this session. Before we move any further, just some housekeeping rules that I want to share. We would request you all to keep your microphones on mute during the talk. And if you have any questions, queries, and comments, do put them in the chat, as we'll be monitoring the chat throughout. We'll also request you to please turn off your camera so that we can secure the bandwidth. With this, I would now like to invite and introduce our presenter for today. So our today's presenter is Dr. Ahmed Sarki. Dr. Ahmed Sarki is a senior faculty at the Ahmed University, Uganda. He's a public health specialist with an interest in non-communicable diseases, reproductive, maternal, newborn, child, and adolescent health. And a systematic reviews with meta-analysis. He teaches microbiology, community health, research, and introduction to teaching and learning, and epidemiology as well. With this very brief introduction, I would like to invite Dr. Ahmed Sarki. Over to you.
Thank you very much, Abir, and good afternoon, everyone. Once again, thank you so much for taking time out of your busy schedules to join. I know parts of Uganda, we are trying to prepare for reopening, and other parts of East Africa have already started teaching online, have resumed fully. Now, title for my talk is Online Teaching Experience Pre and During COVID-19 Pandemic. And as shared by Abir, this is my brief biography. I'm a senior faculty at Sonam, Uganda. I was recently an associate fellow of the Advanced HE, that's the Higher Education Academy in the UK. I'm also the research coordinator for Sonam East Africa, so I do a little bit of research. I'd like to begin with some favorite quotes about teaching and learning. And the first one that always captivates me is that the mediocre teacher tells, the good teacher explains, and the superior teacher demonstrates. However, a great teacher inspires. And this is by William Arthur. So I'd also and always strive in my classrooms, in any teaching or learning engagement, to inspire students to be better than they came into my sessions. The second quote is also about learning. And it says, and it's very applicable to today's challenges of COVID, which no one envisaged coming in January 2020. So in a time of drastic change, it is the learners who inherit the future. And the learners usually find themselves equipped to live in a world that no longer exists. In fact, you can even create a world for yourselves, because when we are caught up in a situation and we have no solutions to it or no preparedness for it, we really have to be innovative and find clever approaches to carry on living and continue existing. So it's very applicable today as it were in the years this quote was created. Now, I'd like to share a bit of what guides my teaching philosophy. Based on my background in public health, in microbiology, I always aspire to be inclusive in whatever I do, be it in practice or in the classrooms. And I thought it would be useful to share what inclusive education means, because it's not just a name tag, but it actually refers to a model where, you know, we have a lot of diverse students. In this case, I'm Nigerian in Uganda, and within our classrooms, you have diversity in age, from the nurses, you have diversity in gender, you have diversity in places of living. Some of our students live in very remote areas. Some of our students live in high-end urban areas. You have diversity in financial status or social standing within the society. So all these are diversities that could affect effective teaching and learning in your classroom. And if you don't pay attention to those, strands or factors, they could really derail or actually defeat the objective of teaching itself. And some students may naturally be demotivated. Now, having said that, it is a model, the inclusive education model applies to students with disabilities in its initial scope. But we do know that successful inclusive education materializes only through accepting, understanding, attending to student differences and their diversities, which include, of course, physical, cognitive, academic, social, and I would add technological differences, because some of them have access to technology, some do not, some have limited knowledge of technology, and some are very avid users of technology today. And also, of course, emotional variations. And the three theories that govern inclusive education are the behaviorism, the cognitivism, and constructivism. With respect to the behaviorism-based inclusive education, this is a predominantly psychological model used to impart knowledge of reality to learners. So what is real around them? You know, I teach microbiology. Today we are engulfed with a virus, a viral disease that led to a pandemic. In this part of the world, we had Ebola recently. We always have cholera outbreaks, sporadic cholera outbreaks. So again, that's reality. So how do I impart and translate that reality into the minds of the learners? Okay, cognitivism-based inclusive education practice focus on learners thinking, their memory, how they self-reflect, and being able to motivate them to learn. So the courses I teach are not really exciting. Microbiology, research, epidemiology, they find it challenging. Community health, it's not within their comfort zone of the normal nursing clinical practice or midwifery practice. No, it takes them and stretches them a bit, So how do I motivate them to stay enthused, to stay excited, to want to learn, and to want to see my face whenever I come in, so that they would want to listen to me, okay? And then the constructivism-based inclusive education practice, which involves a learner understanding the significance of the social dimensions during the learning process. So when we put them in groups, how are they able to understand their own position, their weaknesses, their strengths, their ability to allow others to be heard, or are they just going to dominate that group? Okay, so I think in general, as facilitators of learning, we should be adopting some of these models in our day-to-day teaching. So fast forward to the main topic at hand, pre and during COVID, what is my experience of online teaching? So I must be honest, brutally honest, pre-COVID, I rarely use, any video conferencing for teaching. I know I adequately use Moodle because that's the virtual learning environment that we have at Aga Khan, which is extremely remarkable. And the team that are helpful, the Kurams, the Stevens, the IT guys, they're all brilliant. So we never have challenges, and I think I'm an adequate user. I might not say I'm an excellent user of it. That's owing to the face-to-face contact that we have with our students. Of course, I try to make sure my presentations, my lecture notes are interactive and compelling, such that the student will still be motivated to want to, read about a certain virus or a certain bacteria or a certain fungi, and its epidemiology and its prevalence, and how it, the pathophysiology of it, the pathogenesis of it, and whatnot. So, when COVID struck in Uganda, personally, we were shut down on the 18th of March, but it took effect on the 20th of March, 2020. And then within a week, the management here at Sonam Uganda were very supportive and, called us and were able to explore avenues for continuing teaching, just so that, the flow and the process is not really affected significantly. So I was one of the few faculties to begin using Zoom for online teaching and learning at the time. I tried within that short period to test a variety of andragogical and pedagogical skills and principles to my online teaching. So what I've been doing face-to-face, you know, the teaching strategies, I may not have the flexibility to do all of that and apply all of that in the online teaching environment. Again, I must admit it was fairly new to me. Using Zoom to teach, I had to read up online, I had to watch YouTube videos, and then of course we had certain trainings afterwards. But even before the trainings, I had to read up, I have to, you know, use some of the experiences during my postgraduate certificate qualification to do some assignments to, you know, such as, you know, breakout rooms, putting students in groups, allowing them time to interact with one another, and so on. But of course, there were some challenges with internet connectivity, inclusivity, sheer amount of preparation, and that refers to the amount of work required for the online teaching, which was double that which I do for the face-to-face sessions. I'll be talking about some of the adopted pedagogical approaches that I used, you know, interactivity. So we do know as academics that interactivity is the soul of asynchronous learning. And if you don't enable the students to engage with one another, to engage with the teacher or faculty, to engage with the content, and also being able to give them feedback, then you would really struggle with, you know, getting your students to remain enthused and to be able to learn, to achieve the objectives, the learning objectives of that particular session. The second approach I adopted and I really utilized was enabling students' engagement. And with this specific engagement is by allowing, you know, students to assert themselves into the process overall. And the process, again, the content, me as a faculty, their peers, you know, with the feedback I give, you know, and of course we know the social constructivist beliefs is that students, you know, they tend to ensure that students assert themselves to learn just so that they are not suffering in isolation and they don't struggle with social isolation, if you like. Of course, the cognitive psychologists encourage us to believe that people naturally go at their own pace, you know, and so that really applies. When a student is at the comfort of his room or her room, in one remote corner or in a posh corner of Uganda, they feel they're the only one there, no one is seeing them. So how do you enable them to immerse themselves, to really commit their time and their interest and remain motivated or captivated for the 1 hour or 1 hour 30 minutes of your session? Okay, so that's one approach I'd really try to use, and I'll be able to answer questions as the approaches specifically. The last is presence. And again, this is not just a tag, you know, I've really learned that, you know, for you to get students' interest and them remain motivated, you need to strive for presence as a faculty. And that presence transcends to their social aspects, the cognitive aspect, the teaching practice itself, how you give feedback. Okay, are you always present? Can they reach you? Are you accessible? Because now they can't see you, and we never knew when schools will resume. I mean, we were shut down in March. We are only beginning to resume in October. That's some 6 to 7 months in between. When it started, no one saw the end, and we never knew what will happen. So how will you continue being present as if you are there face-to-face with them? So these are some of the approaches I use in terms of the pedagogical principles. With respect to the andragogical principles, again, nearly 95%, I think, if I'm being conservative, of our students are adults. So how do I involve them into the planning process? Okay, how do I tap from their experiences? You know, how do I ensure that the content, because I had to tweak the content, some of them, including the mode of delivery. When I say content, I'm not saying the course curriculum itself or the course outline, no, the delivery itself, okay? Some of the things I had planned, you know, for face-to-face, how do I now tweak them to make sure they are still relevant and they impact on the learners, okay? Did I adopt problem-centered teaching approaches or learning facilitations? So I had to explore all these things and bring them into my classroom or my typical sessions. I did highlight the challenges in my summary slide. So of course, as you know, this is as part of the Global South, which Pakistan is of course, and you know, Kenya and Tanzania, you know, there are challenges with internet connectivity. So some students within the session, you could just find that they've gone. So how did I remain in touch? I'll share with that in terms of the solutions. But there were issues with internet connectivity. There were issues with inclusivity. Some found that my pace was a little bit faster. Some found it was a little bit slower. Some told me, you know what, I really enjoy your session and we want more time from you. So time management was a challenge because I realized for every session, I needed double the amount of time to prepare than I was putting in the face-to-face session. Then strong motivation. That was a challenge to be able to ensure that these students remain motivated from the beginning, middle, and end of every session. So what were the strategies or solutions I applied to some of these challenges? Flexibility. I did ask my students to, you know, find ways, suggest ways that we could be able to achieve the learning objective, the desired learning objective. Some of them told me, faculty, I'll be happy if I can reach you via WhatsApp because I don't have a laptop, I use my mobile phone. And when the internet is bandwidth is low, or you know, I struggle with the internet connection, or if it rains, you know, that's a challenge. Can I be able to ask you question via WhatsApp? Can I call you? I said, yeah, why not? So you could find that I spare, in my preparation, I spare an hour after every typical class for those who had challenges with internet connectivity to be able to reach me, and then I could direct them to their peers. I always put them in groups. They're always in groups here, typically. So I refer them to some of their peers and I encourage them to share with one another. And I also try as much as possible to respond to their questions without taking much time for other activities. Okay, and that flexibility I think helped because in the end, during the face-to-face sessions, I'll give you an example of epidemiology as a module. I always take 1 hour or 1 hour, 15 minutes. The students said to me, faculty, during this week, you know, because you are one of the first few to start, how about you take more time? I said, no, I can't take more time in a day because of the attention span, but I can give you another day if you feel that's workable. So they came back to me and said, okay, let's set a particular Thursday and then we can do 10 to 11 or 10 to 12. So again, that helped me increase faculty student time. And for some who struggled in joining one session, we're able to catch up with the other session, pose questions, you know, interact with me, their peers, and with the content, you know. I encourage networking opportunities, and that is at the heart of, you know, ensuring that there is interactivity with the content, with themselves, with the feedback that I'll be given. And in terms of giving feedback, I made sure I borrowed from those behavioral, constructivist, and cognitive theories in giving feedback, because you'll agree with me, the pace of learning differs from student to student. The pace of understanding differs from student to student. Some may listen to the lecture but would struggle with, you know, processing the information. So again, when giving feedback, or in terms of the questions they pose to me, or in terms of how their group performed in their breakout sessions, I try to be as inclusive as possible. So thank you very much.